hypercholesterolemia means that there is an increased amount of cholesterol in your body. And when you have a high level of cholesterol, it gets stored in the blood vessels and in all the important internal organs. We need to keep it below a certain level to avoid the complications. There's not much difference. It's just different in terminology. So high cholesterol means that the cholesterol is high. Hypercholesterolemia means that this is a condition in that person. So you're calling it as a disease now, that this person has hypercholesterolemia. You can say this person has high cholesterol, or you can say this person has hypercholesterolemia. It can be genetic, and that is a very, very important question. And we need to understand that there is a possibility of genetic predisposition to hypercholesterolemia. There's a very clear guidelines and indicators to when we should suspect that. And the most important criteria in that is age, because we know that after a certain age, after 40, 50 years of life, just the natural aging process, we can have slightly high blood pressure, high cholesterol, which is kind of accepted. It doesn't mean that you don't need treatment for that, but you can understand why it has happened. But if someone very young, like in their 20s or 30s or 40s, have very high cholesterol, then you suspect that is there a genetic problem. One other way of looking at it is if the person has a very strong family history, that, oh, my father had a heart attack in 40s, or my uncle had a heart attack in 30s, or my mother had a stroke in 30s, which is unusual things. So if you have an unusual and a very strong family history of complications due to high cholesterol, like a heart attack, a stroke, vascular problems, and then you also have a very high cholesterol, then there is a possibility that you have a genetic predisposition. So it's very important to identify these patients. They should have a genetic testing to confirm the diagnosis, because if they have that, that means they are at much higher risk of developing cardiovascular problems at a very early age. So we need to start treatment quite early on to prevent them having these problems. There are signs and symptoms, but there might not be any signs and symptoms for years. So it's important to understand that there are some people who have high cholesterol and they might not know that. Therefore, after a certain age, after 45, 50 years of age, the primary care physicians will check your cholesterol, blood pressure as an annual check, just to see that you are in a healthier range. If you have a family history, a strong family history of high cholesterol, or you have family members who have been affected by problems caused by high cholesterol, then you can be screened quite early on. But if someone had a heart attack or stroke or a vascular problem at an early age, then they should be checked for it as well. Sometimes if you have very high cholesterol and it's undiagnosed, you can have some signs like skin manifestations. It starts, the fat gets so high in the body that it starts storing on the skin. So you can see skin changes. You could be around your eye, we call it xanthelasmas. You can have xanthometas, which are like a papules, whitish papules all over the skin. You can have around your joints, around your elbows, around your ankles, behind the ankle, but these are not common. But if you have that, then it's high possibility that you have genetic condition and not just simple cholesterol. The reason we have to identify it and treat it, because you have to see that cholesterol, where cholesterol is going to hide, where it's going to store, it gets stored in your blood vessels, in your pipes. So when the blood is flowing, it has to flow easily, so it can reach all part of your body. But if it is, the blood vessels are blocked with the fat, the blood will not flow there. And if the blood vessels are blocked, then the organ it's supplying to, it doesn't receive the blood. that organ will die. And that's what heart attack is. When the blood doesn't reach his heart, it's a heart attack. When blood doesn't reach his brain, it's a stroke. When blood doesn't reach his foot, it's an ischemic foot. And the main problem is that the pipes, the blood vessels are blocked with extra fat. There are very good medications available now for hypercholesterolemia. I tell my patients that we are lucky to be in this century where statins been found. People are living longer in Western countries, mainly due to statins, because the way our lifestyles are, very long sitting hours, desk jobs, watching Netflix in the evenings, our blood is not flowing easily in the blood vessels, and the diet and extra fat around us, all the food that we eat changes into cholesterol, and then it gets stored in the blood vessels. And with these invent of these newer medications like statins, ezetimibe, fibrates, and then now there are new injectable medications as well that you can have an injection twice a month, and it keeps cholesterol right under control. Your blood vessels will be crispy clean, your blood will flow nicely in the blood vessels, and people live longer. It increases your life expectancy. So there are very, very good medical therapies available for high cholesterol. So I can't justify in Western world if people are still dying of hypercholesterolemia, because there are plenty of treatment options available. Lifestyle changes always help, but in a certain group of people and very specific conditions and up to a certain point. The way I see it, and I always tell my patients as well, that the way our bodies are designed, there is a natural wear and tear process. If the way we changes externally, our skin, hair, nails, they all show signs of aging. Our internal body also shows signs of aging, and that means the blood vessels become a bit thinner, they start storing a bit of grease, cholesterol, the blood pressure increases, the pressure with the blood flows in the vessels, which is the blood pressure, that increases. So there is a natural wear and tear. So you will see patients who have tried everything and they are not fat. They have a normal BMI, they are eating healthily, they're doing everything, and their cholesterol is still high. And if you keep putting this pressure on them that, oh, do a lifestyle change, they feel like a failure. They feel like no one is listening to them. They are doing everything right. So at that point, we have to acknowledge that it is a natural, organic aging process, and sometimes we need help to reverse these things. Just like any kind of machinery you have used over years, it's not the same as a factory. When you buy it from a factory, human body is like that as well. And if options are available, the treatment options are available to help, then why not? So to answer your question, it does help, but it sometimes cannot help completely, and you do need help with medical therapies, just like we need help with maintaining our exterior. We need help with maintaining our interior as well.